I'm actually here representing, I would say, two different organizations in town. I'm the Tucson Regional Coordinator for the Silent and More Awareness Campaign. That is not a political organization, but it's basically an international organization that tries to bring awareness to people on behalf of those who have been involved in abortion decisions. And then I also work at the Crisis Pregnancy Center just down the street on Speedway. I'm the assistant director, and a lot of what I do there right now is post-abortion support groups. So I'm here on behalf of both of those organizations. What I'm going to be talking about today is specifically some of the laws that have been enacted in Arizona recently. And these were laws that Planned Parenthood actually took to court because they didn't want them to go through. Once the court upheld them, they decided not to appeal it further. So the two big Supreme Court decisions were obviously Roe v. Wade and Doe v. Bolton. And I'm just wondering, do you know specifically what those two decisions did in terms of legalizing abortion? You guys can talk to it if you got separation here.
What the decision meant?
Yeah, what did it actually do in terms of making abortion legal?
I would like the law students to answer.
Okay, I'll answer. So in 1973, in January, the Roe v. Wade decision said that the right of privacy that is found in the Due Process Clause of the 14th Amendment includes the right of a woman to decide whether or not to terminate her pregnancy. It also said that the word person in the 14th Amendment does not apply to the unborn. So that decision is what took away any laws restricting abortion in the first trimester, so up through 12 weeks. A few months later, the Doe v. Bolton decision, I'm actually going to read this, authorized abortion when continuing the pregnancy would endanger a woman's life or health. Now, previous to 1973, it was always the case that if the woman's life was in danger, abortion was legal. What Doe v. Bolton did was added the word health. And specifically, the wording says the medical judgment may be exercised in light of all factors, physical, emotional, psychological, familial, and the woman's age relevant to the well-being of the patient. All of these factors may relate to health. So basically, by adding the word health instead of just leaving it life, it allows for abortion for any reason. Most states do have restrictions in place once you get into the second trimester, but technically, anyone can have an abortion through all 9 months of pregnancy if the doctor agrees that it's for the well-being of the health and life of the mother. So in Arizona, the law specifically says that abortion is legal through fetal viability, which generally means 22 to 24 weeks. Here in Tucson, Tucson Women's Center will do abortions up to 17 weeks. Beyond that, they do go up to Phoenix, and up there's at least one clinic that will go to 22 to 24. It's interesting that if you actually read the Arizona statutes, it says specifically that if the remains of the abortion are under a certain weight, it's considered medical waste. If it's above a certain weight, they actually have to issue a death certificate. So whether or not this is viewed as a person is dependent on how much it weighs, which is rather arbitrary and ridiculous. So, according to Guttmacher Institute, which is Planned Parenthood's research arm, in 2008 there were 1.2 million abortions. Between 1973 and 2008, there's been nearly 50 million. And that number is actually quite conservative because there are states that don't report their abortions. California and New York are two of them, and those are two states that tend to have the most. So those numbers are quite conservative at this point. And so that means about 3,600 abortions are done every day in this country, and those are elective procedures that are being done. So what I wanted to talk about was what is the information that women really should be presented with when they're considering having abortion. I would say that the obvious things would be information on fetal development. The fact that a newly formed embryo at the moment of conception is a new, unique, living human entity in and of itself. When you get the DNA from mom and dad, as soon as it forms, or joins, it forms that new, unique DNA strand. And because it is growing and metabolizing nutrients, it is a living being. So women should know that they are, at the very least, ending the life of a living human organism. The heart begins to beat at 21 to 25 days after conception. So that's already happening before women even know that they're pregnant. On ultrasound, the heartbeat can be seen as early as 4.5 to 5 weeks. It can be heard at about 5.5 to 6 weeks. By 8 weeks, upper and lower limbs are already evident, including elbows and fingers, so you can see that much detail on an ultrasound. The fetus at that point is already making its own blood in the liver, bone marrow, and spleen. Spontaneous movement begins. The majority of abortions are done in the first trimester, so prior to 12 weeks. Again, Guttmacher Institute says that about 88% of abortions are done prior to 12 weeks. Most of those occurring between 12 and 9. So those things that I just mentioned as far as fetal development, that's already happened by the time those abortions take place. How the abortion procedure is done should be explained to women, and what it does to the fetus should be explained. I'm not necessarily saying that graphic pictures have to be used in that process of explaining it, but you really can be graphic enough when you talk about suction abortion or a D&E to get that point across. Potential physical risks. There are immediate physical risks that can occur. They're bleeding, hemorrhaging. You can end up needing a hysterectomy because the uterus being punctured. There's all sorts of things that can actually happen at the time of the procedure. Infection is pretty common. And potential emotional risks. Now, I know that the American Psychological Association denies that there is any kind of stress or trauma associated with induced abortion. There was a study done about 5 years ago in New Zealand by a researcher who was not pro-life. He fully expected to find that there was no difference in emotional consequences to induced abortion or giving birth. And what he found in his study was that there is an increase in depression, anxiety, and substance abuse among women who have had abortions as compared to women who have given birth. So that is a pretty good study that was done, that was really done unbiased. Now, granted, research studies, you can manipulate data to give whatever results you really want to give, but that's a pretty solid one that's available. So let's see, another thing that women should be told is what other options are available. Obviously the two that typically would contrast abortion are adoption and parenting. And not just to mention that, okay, yeah, you can parent or you can adopt your child out, but to really give information and give resources that are available in the community to help women with making those decisions, if that's what they choose to do. Viewing an ultrasound, hearing the heartbeat, seeing what the fetus looks like. Again, statistically, it's estimated that about 80% of women who view an ultrasound who are considering abortion will change their mind and decide to carry the pregnancy. And it's because they're seeing the truth and they're seeing the humanity of the unborn on that ultrasound. Those are all things that Planned Parenthood, National Abortion Rights Action League, any of the really pro-choice organizations typically will take legal action against. They have those laws put in place. In 2009, the Abortion Consent Act in Arizona was signed by Governor Brewer, and there were 4 parts to it. The state will require a notarized parental signature before an abortion can be performed on a minor child. Women will be provided with full and accurate information by a doctor in person at least 24 hours before an abortion. Medical professionals cannot be forced to perform abortions if it contradicts their sincerely held religious or moral beliefs, and non-doctors will not be permitted by law to perform surgical abortions. So, I think those are fairly straightforward, good things for women to have in place. But this was taken to court, and it just in the last few months was ruled by the court to be constitutional, that it was okay, and Planned Parenthood has decided not to appeal it. So when looking at this, the whole issue of parental consent, let's look at any other issues that kids are not allowed to be involved in. You can't drink until you're 21. You can't vote, gamble, join the military, sign a contract until you're 18. You can't drive until you're 16. You can't have any other medical procedure done without a parent's consent. But abortion is one of those things that's taken out of typical medical protocol, put over here under the right to privacy, and that's what's used to allow them to have all these things done without parental consent. But if you think about it, what young kid at 14, 15, 16 years old really understands the implications of making that decision? Any law that requires parental consent does have an exception so that she can get a judicial bypass, and that is the case in Arizona even with this going into place. So she can go to the court, a judge can issue her a bypass that allows her to get an abortion without her parents' knowledge. This ruling is typically done within 48 hours. My question on that would be, judges are experts in law, but not necessarily in psychology. So what gives them the knowledge and the ability to determine in that short of a time span that a 14 or 15-year-old is mature enough to make that decision on their own? And yet it happens all the time. It's supposed to be just for situations where there could be a risk of abuse occurring in the home, where the parents, they don't want the parents to find out that she's pregnant because of the potential for abuse. But really, she could get help with a potentially abusive situation from other agencies in town without having to get an abortion secretly. And I'll just give an example. In working at Crisis Pregnancy Center a couple of years ago, I had a girl come in who was 3 weeks away from turning 15. Her boyfriend was 15. Her reason for not wanting to tell her parents that she was pregnant and wanting to get an abortion was because she lived with one parent here in Tucson. Her older sister 2 years earlier had been in the same situation. And when the parent here in Tucson found out that she was pregnant, she had to go up to Phoenix to live with the other parent. That's what this girl didn't want to have happen. At 14 years old, she got a judicial bypass and was able to have that abortion without her parents knowing about it. That's not any kind of a life-threatening situation where a parent should be involved in that decision. And I question, just from my interaction with her maturity level, to really be able to make that decision and understand the implications. So really, to fight parental consent laws is ridiculous. I mean, especially it's contradictory because there aren't those kind of fights going on for, well, kids should be able to smoke and drink and all. People are perfectly fine with that. They just want the kids to be able to do this on their own. When you talk about being provided with full and accurate information, this is another part of this act here in Arizona. Again, any other medical procedure, all of the potential risks are going to be discussed with the patient prior to the procedure being done. I don't care if it's a tooth being extracted or major surgery. The doctor comes in, the anesthesiologist comes in, everybody comes in and tells you all of the possible things that could happen, no matter how remote they are. You know, when you buy a bottle of aspirin, you get a piece of paper this long with it that tells you all of the potential drug interactions and contraindications and all of that. But with abortion, it's never been required that the doctor performing the procedure give that information to the patient. Typically what happens is that the girl doesn't even meet the doctor until he or she comes into the room for the procedure. Nothing before that. And the whole intent of Roe v. Wade was that the woman would, in consultation with her doctor, make this decision. And that's not what happens, because typically women don't go to their own doctors to get the procedure done. They'll go to a separate abortion clinic where they never meet the doctor, never have any kind of patient-doctor relationship with them, and have it done and then never see them again. That's typically what happens. So the law now in Arizona says that the doctor actually has to sit down, and there is a state-mandated script that they have to read that includes fetal development, potential health risks of the procedure, how the procedure is done, who the doctor is who's doing it, and what their other options are. I think it's sad that specific laws have to be put into place in order to make sure that women actually get the information that they should be getting anyway. Now, ultrasound is not a part of this particular law, but there are a number of states that do have mandatory ultrasound laws in place. And what's interesting is that if you go to Planned Parenthood's website, they actually refer to these laws as dangerous ultrasound laws. Now, the procedure ultrasound is not in any way, shape, or form invasive. It's not harmful to the mother. It's not harmful to the fetus. The only reason it's dangerous is because women change their mind when they see an ultrasound. But again, if that's going to happen, then if you're truly pro-choice, doesn't the woman have the right to have all of this information so that she can make the choice that she wants to make? And if the choice is to change your mind from abortion, then she should be able to do that. And if you're going to oppose laws that require that women be given all of the information that they need to make a good decision, then we're not really giving her a fully informed choice, which I think defeats the whole purpose of claiming to be pro-choice. And it's interesting, I don't know exactly when this statement was made, but there is a woman named Naomi Wolf. She's a pro-choice columnist. She at least used to work for the New Republic. I don't know if she still does. But she actually said, and she's very, very much a feminist, very much pro-choice, abortion on demand, no apologies. But she says that if we, meaning pro-choice people, claim that it is offensive for pro-choice women to be confronted by the truth, then we're making the judgment that women are too inherently weak to face a truth about which they have to make a grave decision. This view of women is unworthy of feminism. So this is a pro-choice person, woman, saying, yeah, women should get all the information they need to get. Now, she made this statement specifically in regards to saying that it was okay to use graphic abortion images when teaching about the issue of abortion. Saying that if those images truly do inform and depict what abortion really does, then we shouldn't be, we meaning the pro-choice side of this, shouldn't be squeamish about having those graphic images used, because again, it depicts the truth. And to assume that women are not strong enough to see the truth, you're denying them the choice and the protection that you're saying that you're fighting for, which is obviously contradictory. So those are, there are a lot more laws that are, attempting to be put into place. There are laws for spousal consent, at least spousal notification. What's interesting is that prior to birth, men have no say and no right in what happens to their child. After birth, even if they don't want to have anything to do with that child, they can be legally forced to pay child support. So again, that really is a contradiction. If you're going to force them to be responsible after a child's born, then shouldn't they have some say in what happens to their child prior to birth? And a lot of men are hurt emotionally by the fact that a girlfriend or a wife goes off and has an abortion without telling them, or by telling them and saying, I don't really care what you think, I'm going to do this because it's my choice. And that really is sad that there is no legal recourse for that in those kinds of situations. And again, I'm not going to even attempt to give a quote on how much of Planned Parenthood's business is abortion, because depending on how the statistics are broken up, it can make it look like it's a very small percentage, or it can make it look like it's a huge percentage, so I'm not even going to go there. What I do know is that when you look at the cost of abortion, first trimester, they will start at $450 for an abortion procedure. Those procedures take tops 15 to 20 minutes. You're telling me they're not making a profit on doing these procedures? I think they are. In Tucson here, at that 17-week point, it's almost $1,200. Up in Phoenix, when you get into the 20-22 weeks, it's about $2,500. They are making a profit on doing this procedure. And anyone who's going to make a profit off of that, can they really be 100% trusted to be putting the best interests of women at the forefront of how they market and how they provide information? I'm not saying that all doctors are, dishonest. I know that there are some who are very careful about performing abortions and, wanting to make sure the women are fully informed and that sort of thing. But it still does happen where this information is not being given out. At CPC, when I work with women who have had abortions, I've had women who have come in who have just had their abortions in the last couple of years here in Tucson. Prior to this act going into place, they still were not being given correct information. They were being told that this is a blob of tissue, a clump of cells, not a human being, not living, no information about the fetal development. And you can, I suppose, make an argument for the fact that, well, that information is available on the internet, and, if you're a consumer, shouldn't you get all that information on your own? And while to some extent that's true, and it is readily available on the internet, it's also true that when we go to somebody who is supposed to be the expert in a field, it's fair to assume that they're going to give you all the information that you need to make a decision about whatever the services that they provide. So if I go to an attorney, they obviously know a lot more about the law than I do, so I'm going to assume that they're going to provide me with information so that I can make decisions that are in my best interest. If a woman goes to a doctor to have an abortion, it's fair to assume that they're going to give all of the information that they need to in order to make a good decision. And unfortunately, that doesn't happen in a lot of places. One of the other parts of this act is that non-physicians can no longer do abortions. Planned Parenthood had 7 centers in the state of Arizona. 7 of those have closed because at all 7 of those surgical abortions were being done by nurse practitioners and I think others. And again, this is completely different from anything else in the medical field. Abortion is a blind surgical procedure. Unless it's done guided by an ultrasound, the doctor cannot visualize what they are doing inside her uterus. It's done all by feel. So I would think that it's better to have a trained physician doing this procedure, especially when there can be the kinds of complications that there can be, rather than a nurse practitioner. And I don't know of any other invasive surgical procedures that a nurse practitioner can do in place of a doctor. And one of the arguments that's used is, well, that means that all these women in all of these other parts of the state now don't have access to safe legal abortion. But again, if you're in a rural area, you probably don't have access to safe orthopedic surgery, or, excuse me, or any other types of specialized surgical procedures. You still have to travel to receive that kind of care. So again, why do we make the exception for abortion? It should be treated like other medical procedures. And if you live in an area where you have to travel, then you live in an area where you have to travel, and that's just, the way it is. So that I don't see that as a really valid argument for why somebody else could just be trained to do this. I am going to share now just a little bit about my story, and then open it up for questions if anybody's got any. In 1984, I was 17 and a senior in high school, and I got, actually it was in 83 when that happened. I was taken advantage of by a family friend, and as a result I got pregnant. A couple of months later, it has now become February of 1984, I did go to Planned Parenthood, got a pregnancy test, and they didn't give me anything. They did the pregnancy test, said, yeah, you're pregnant, what do you want to do? Again, supposedly the experts in this. I said I was thinking about having an abortion, and they gave me a list of clinics to call. I got no information on fetal development, no information about options, nothing. Called and made an appointment. 2.5 weeks later, went to the clinic to have the abortion done. Was told that I needed to speak to a counselor, and basically all they said was, but again, no information. I signed a piece of paper, I had no idea what it said, they didn't ask for any ID at that time, they knew nothing about me, no medical history, nothing. I didn't have any kind of a physical exam done. I thank God that physically nothing happened to me. I was about 10 weeks pregnant. I was awake for the procedure, so I did see and feel and hear everything. It was over in about 15 minutes, and pretty much for the next 20 years, I was a mess. Depression, anxiety, using alcohol, got into an alcoholic marriage, pulled away from my family because I didn't want anybody to find out what I had done. And it was recently, just in 2004, that I finally started getting help. And the root of all of these things was abortion. And once I dealt with that and grieved that loss and really acknowledged what I had done, that's when I was able to heal from that. And a big part of that was finding out for the first time what my baby looked like and how developed it was at 10 weeks of pregnancy. And that was information that I didn't have at that time. Had I been, I can't go back, I can't say that absolutely I know I would have made a different decision if I had gotten all that information. And I can't turn back the clock and know that for certain. But I do know it would have made a difference. And I wouldn't have been 20 years later looking back saying, if I had only known the truth. And that's what happens to so many women. And it's easy to say that, well, that was 28 years ago, that's not happening anymore. But like I said, it still is happening. Women who have recently had abortions still are not getting the information that they need to make a good decision about this. So that's what we do at Crisis Pregnancy Center. We really make a point of giving them information about fetal development. It's all factual. We've got all the sources that back up the information that we provide them. We give them information about the procedures, what costs, what their options are, the help that's available, the resources that are available in the community. We do provide free sonograms. They can get a free consult with an OBGYN who's licensed in Arizona to talk to them about their pregnancy. So we do try to provide all of the information that somebody needs to make a decision. Now, obviously, abortion is a legal decision or a legal option for them to make, and if they choose to do that, we're still available for them if they're struggling afterwards. So we do try to do very comprehensive help with that. If you go, again, to Planned Parenthood's website and look up anything about post-abortion stress or emotional issues after abortion, they basically say that it doesn't exist and that it's something that's made up by anti-choice extremists, is the word that's used on the website, to scare women out of having an abortion. I'm not saying that everyone who has an abortion has a problem with it, but I personally have worked with at least 100, if not more, over the last 5 years I've been doing this, and they all had problems with it. And there's a lot of other groups across the country that experience the same thing. So it does happen, and to make light of it and to say that it doesn't exist invalidates what a woman might be feeling after she has an abortion, and then she doesn't know where to go with that. Because if she's being told that it has nothing to do with abortion, she's going to look for other reasons for feeling the way she feels, and as a result, she's not going to deal with it the way she needs to. So it's interesting to me that an organization that always says that they are pro-woman and so concerned with the well-being of women so often does things really to, I'm not saying deliberately hurt women, but certainly indirectly hurt women because of a political agenda, which is unfortunate. So that's the information that I have, and I am open for questions if anybody's got any. I don't know if I can answer it, so I'll give it a shot.
What other things would Planned Parenthood do?
Depending on the office, there are Planned Parenthood centers that do provide birth control. Some of it free, some of it low cost. Some do provide pelvic exams and pap smears for women, STD testing. What else? There are some that are quite comprehensive, medical services that are available, like the Tucson Women's. Now, I don't know if the Tucson Women's Center is directly affiliated with Planned Parenthood here in Tucson. They're right next door to each other, but I don't know if there's an absolute connection there. But yeah, they do pretty much all OBGYN services, so even prenatal care. But again, it depends on the center and how they're staffed. And there are some Planned Parenthood clinics that all they do is abortion. So.
The reason I ask is the argument to be funding Planned Parenthood via Congress, at least the federal incentive they get. Of course, most people say that they do too many things, and abortion is just a small facet. But it seems to me like everything they do can be covered by the woman's family physician.
Pretty much, yeah. And the whole defunding argument, and when you start looking at those statistics and the percentage of abortion and how much of their services are abortion, it depends on who you talk to. Now, I know that Abby Johnson, who used to be a Planned Parenthood director in Texas and is now pro-life, she said that the way they, at their center, would switch up those percentages is instead of saying that someone who came in for birth control pills, that was one visit and she received a whole package of 12 pills for a year's worth of pills, they would count that as 12 separate visits because it was a year's worth of birth control pills. So even though the person didn't actually come in once a month, they still counted it as 12. So if you do that enough times, you can make birth control services a huge percentage and abortion a very small percentage. But if you count it based on the actual number of times she went into the office, and that drops down to 1 instead of 12, that shifts things a lot. So when Planned Parenthood says that only like 15% of their services are abortion related, chances are they're counting all of their other services differently to make it look like that. Planned Parenthood is the world's largest provider of abortions. And they do admit that. So, and yes, all of the other services could be done by a family physician. So the claim is that for women who don't have insurance, who don't have a family physician, they are their source of those kinds of services. And that may be true. But again, with the, Planned Parenthood technically is a nonprofit organization. But if you look at their financial information, every year they have a huge profit. So they get a lot of money from a lot of different sources, whether it's charging for their services or private donations, corporate donations. They could lose that tax money and still have plenty of money to do what they want to do. Okay.
Do you find that the women that seek post-abortion counseling, because you kind of hear the argument like they wouldn't feel bad if we didn't make them feel bad. So how do you respond to that?
I've had women who have had problems with abortion from all different faiths, who are atheists. It's not, religious beliefs or, because you're a faith-based organization, you're making them feel guilty about it. When I've been to the exhibits with Justice for All, there have been women who have said, I know I did the right thing, but I still feel bad about it. I still feel guilty. I mean, the truth is, it's not the same as having your appendix taken out. If this truly was just a clump of cells, a blob of tissue, no different than your appendix, you wouldn't feel bad about it. But somewhere, even if they see it as a potential human being or a potential person or human life, that's the part of it that makes it different. And so women do struggle with it and often do regret it, even if they feel relief right after because their problem is gone. There still is grief and regret a lot of times associated with it. And I think that needs to be validated in the women who are experiencing it. It's not just hormonal. It's not something that's going to go away as soon as your hormones get back to normal, which is what a lot of times they're told. I think that needs to be validated, that, you might feel this, and if you do, you can help. Instead of saying, well, the only reason you feel this is because you had psychological problems before. And that's one of the things that my parents will say, that those who have problems afterwards had problems before. And yeah, that's true, but that's not the only women who have problems. I was pretty normal beforehand. Grew up in a good family, had a pretty normal childhood, was stable emotionally. So yeah, that's, there's something in women that know. We know that it's something wrong. And that however we define that life or that living thing, we know that we're ending the life of something.
How many states have these spousal consent laws?
Spousal consent, very few actually.
Very few.
And even the states that have attempted to get them, that's usually struck down by the court as being unconstitutional.
And does that include like a boyfriend, girlfriend,
Yeah.
or is it just okay.
Yeah.
You mentioned that if the baby that was aborted weighs a certain amount, that they are to give death certificate. You know what that really is?
I don't remember, but it's actually spelled out in the Arizona statutes. We have it written down at CPC. So yeah, if you go to like ac.gov and go to the state statutes on abortion, there's a bunch of them because it defines what abortion is. And Arizona is one of the states that actually has in place a law that says that if you kill a woman who is pregnant, you can be charged with 2 homicides. But if the death of the fetus is the result of a woman's choice to have an abortion, it's not. Go figure that one.
Is that viability, or is it any time during pregnancy?
I'm not 100% sure, but I'm pretty sure that it is at any point in pregnancy. So yeah, there's a bunch of laws that have to do with abortion.
When you suggest the adoption alternative, is there have you ever experienced where there's where the woman was not able to get the baby adopted at a hospital? Like in other words, if there's not a wait, is there?
Typically, no. Now, there are some legal nuances with adoption. If you know who the father is, the father has to sign over parental rights as well, and that can be an issue for some people. So again, the father's rights are real arbitrary depending on the situation. It's kind of weird. But so yeah, there are some issues that you need to wade through when you're choosing adoption. By state law, you cannot sign final adoption papers until at least 72 hours after birth. So you've got a 3-day wait where you can choose to, like if you give birth in the hospital and you go home the next day, you can choose to have that baby put in foster care for 2 days until you sign the papers if you don't want to take the baby home. But you have to wait that mandatory 72 hours in order to sign the papers, because once the papers are signed, you can't undo it. So yeah, there are some issues, but for the most part, there are waiting lists of families that want to adopt infants. There are far more families wanting to adopt infants than there are infants available to adopt. So if you have, especially a healthy infant, but even, there's a lot of people who specifically want to adopt special needs babies because they have the capacity, the ability to care for them, and that's what they want to do. So yeah, that's pretty easy to do if you choose that alternative.
I've never in our mind,
Yeah, typically if an adoption doesn't work out, it's because the birth mother changed their mind. And and if you go through an adoption agency, they are going to be looking out for the well-being of the birth mother and the baby. So all of their adoptive families that are working with the agency understand that at any point in the adoption process, the birth mother can change her mind, and they've got to be okay with that. If you deal with a private attorney, typically they're looking out for the well-being of the adoptive family that they're representing, and that's where it can get dicey for the birth mother, because she can end up getting pressured into signing adoption papers if she truly wants to change her mind. So usually, if somebody comes to CPC and is interested that adoption is an option, we will recommend that she work with an agency where her best interests are going to be at the forefront. Because you can start the process and go all the way to the end and change your mind, as long as you don't sign the papers. So, and usually the situations that occur where there's a legal fight, that's because there's a private adoption that was done with an attorney. Yeah, and girls understand that if they carry the pregnancy to term and place for adoption, that there is going to be grief and loss and emotional things to deal with. But they think that abortion, compared to that, is relatively easy. I'm not saying that women who choose abortion think it's an easy alternative, but they don't get that there is going to be emotional fallout of that as well. Especially when you hear all of the rhetoric of, you know, it's your choice, it's your right, it's not a big deal, it's no different than having kids told, blah, blah, blah. You go out with your life where nothing happens. That's not typically true. I did leave some cards with Doug, with my address, or not address, email address and phone number. So I can come and speak at other types of events, issues related to this. So, and then we also have others at CPC who can come in and talk about different issues. So, thank you.
Yeah, that's what I'm wondering about.
So live action started calling Planned Parenthood all over the United States, and they were like, "No, we don't do that here. Nope, we don't do mammograms. Nope, that's not one of our services." So I think it's really interesting. If you're curious, I mean, you just call. I call all the time. I mean, I do because I think it's important to know, especially when I teach a lot of students at times. And I've had girls who have gotten the abortion pill at Planned Parenthood and have delivered a human being. And that's how they found out that they were delivering a human. And so talk to a girl like that, and then you really start thinking, what's happening there? But that's what live action is doing. They're just finding out on their own the services that are being provided, and it's scary. That out of her own mouth.
Yeah, they'll refer out for mammograms because they don't have the equipment to do that in Planned Parenthood centers.
Right. So I'm just like, oh,
and yet
please,
Susan G. Komen Foundation gives grants to Planned Parenthood because of their quote-unquote support of women's breast health awareness.
Right.
When they're really not doing much.
Yeah. Yeah, I heard it too.
Yeah. I think a lot of people do a lot of things without knowing, you know, and so I just started calling for myself, trying to figure out. I think that's that. And then second interviewing people who have had experiences there, and every single one of people will tell me the same thing, that they just were not given any information. And that's disturbing to me. Even if it's, you know, regardless of the stand that live action is really an interesting group to follow.
Well, yeah, they're the ones that are behind a lot of the investigations that are going on with Planned Parenthood across the country right now because of, you know, covering up rape or incest or sex trafficking, those kinds of things. So, yeah, they've opened up the can of worms for Planned Parenthood.
They actually filmed a director at Planned Parenthood of a pin, and the girl came to see that.
Yeah.
And I did and the director is giving the pin ideas on when his girl can go back to work after his abortion. And it's all filmed.
Underage girls.
Yeah. Underage girls. It's just like, oh my god.
Yeah.
When is it like 18 seconds?
Yeah.
Should you go to jail?
Technically, yes. Yeah, because sex trafficking is illegal. So, yeah. It's actually a federal crime.
I don't know if you guys want any handouts, but I did bring it.